Welcome everyone to this Marrow Health Graduates webinar, where we will be talking about a very timely topic, burnout. And today our presenter is Luan Toscano, based out of Amsterdam currently, and she's a licensed therapist here at Marrow Health and a clinical project coordinator as well. And just a few practical items. We will have a Q&A at the end. So if you have any questions that come up during the presentation, feel free to put them in the Q&A box on the bottom, and Luan will answer those at the end. And there's also time to ask your questions then if you want. Okay, I let Luan take it from here.
Awesome. Thank you so much, Mayu, and thank you all for being here today. I'll give you a quick overview of our agenda and then we'll get right into it. So today we'll start by introducing burnout. So talking a little bit about what it is, what are common signs of burnout that you might see in yourself that could kind of tip you off to the fact that this might be what you're experiencing. Some obstacles that really get in the way of effectively coping with burnout. So if you know that you're struggling with burnout, what makes it hard to manage it? And then we'll start talking a bit about resilience. So what role resilience plays in burnout management, and then how to build resilience. So a couple of concrete strategies and tips you can take with you to help foster a sense of resilience, especially as it applies to managing burnout. And then lastly, just a little bit of resource education about some things you might consider. So to start, let's go to the very beginning. Burnout was first defined by Herbert Freudenberger in 1974, who was an American psychologist, and he first coined this term based on his work in a free clinic for drug addiction. So he was watching the clients there, and he characterized burnout as a set of symptoms that includes exhaustion relating from work's excessive demands, as well as physical symptoms, such as headaches, sleeplessness, quickness to anger, and what he called closed thinking. And so after he first published this paper, the interest in burnout really started to grow. And so although the study of burnout as a whole has come a long way since Freudenberger's original research, there's a couple of things that have still stayed consistent throughout the revised definitions. And a key concept really persists, which is this idea that burnout is really a balance between, or rather an imbalance, I guess you could say, between high demands and limited resources. So that's kind of the crux of how we conceptualize burnout. We will talk a little bit more about that on the next slide though. In the early 80s, researchers also continued the study of burnout, and the first formal instrument to measure burnout was developed called the MBI, and that is the Maslach Burnout Inventory. And based on Maslach's research, an employee is considered burned out if they show these three dimensions of burnout. The first is feelings of low energy or exhaustion, so that physical symptom that Freudenberger had discussed. This idea of this cycle of negativism, which could look like feeling really cynical about your role, or finding yourself like distancing from work, or kind of like mentally withdrawing from the work duties on your plate. And then lastly, a reduced performance or role efficacy. So this could look like concrete output, but this also could look like things like just feeling less creative or feeling less of a sense of accomplishment when you do something that is objectively like on par with your performance standards. And in more recent years, we've also added to the definition of burnout this concept of it needing to be chronic. So stress in the workplace that is chronic. In 2001, another definition of burnout was introduced by a team of European researchers, and they coined this new sort of concept or model called the job demands resources model of burnout. And what this one says is that we kind of can think about burnout, much like Freudenberger said, as this imbalance of demands and resources. And so I've included this here to give a little bit of an overview of what might be considered a demand versus what might be considered a resource, if you will. So some ideas and things that would be classified as a job demand include things like poor pay, any sort of occupational hazards you might face at work, feeling overloaded by work, so just truly a surplus of tasks on your plate, feeling like your job is unstable, so that work might be transient, or that you don't feel like you can see yourself maybe staying in your career long term, and then lack of supports at the workplace. There's definitely more, but these are a couple to kind of highlight what we might consider a label as a demand. And then things that can be termed as a job resource include things like getting regular feedback. So someone at your job taking time to tell you about your performance, how you're doing, giving you coaching, receiving recognition or praise for the things that you're doing well at work, feeling like you have strong leadership. So someone that you look up to, or someone that is like clear in their expectations of you, getting to manage a diversity of duties so that you're not doing the same thing every day or finding that you're bored in the type of work that you're doing. And then lastly, feeling like you have some influence and being able to make decisions at work. So the fact that you can maybe advocate for things to change or improve as needed. And so again, I really want to just kind of hammer home, when we think about burnout high level, there is this pervasive kind of understanding that I want to make sure that we're aligned in, and that it is this imbalance of demands and resources. And then again, really importantly, that burnout is chronic and that burnout does pertain to work. I think sometimes we can think of burnout as pertaining to a lot of aspects of life, but for the context of this specific condition, it really is by definition work specific. So related to some aspect of your work experience. And so before we get too much further into talking about the symptoms of burnout or the prevalence of burnout, which will be coming next, I want to just take a moment to very high level encourage you to think about your experience of burnout. If this is something that shows up for you, maybe you're in this presentation because you're like, yes, I know I'm already experiencing burnout. Maybe you're here because this is something that you are wanting to just be mindful of. Maybe you're not feeling it right now, but you want to be proactive or preventative in figuring out ways to manage it if it ever did show up. So this is not a formal assessment that we're going to do, but just a quick one item assessment to kind of help you place where you may be on this scale. And then you can kind of keep that in your mind as we go through the rest of the presentation. And so what we're going to use here is an adapted version actually of that MBI. And this is called the Single Item Burnout Measure, or SIB. So for this, I'm going to ask you to pull out your cell phone or navigate on your computer to slido.com. And then I'm actually going to go ahead and pull up here this poll that we're going to be able to see and engage with in real time. And so once you go to slido.com, you're going to be prompted to put in a join code. This is completely anonymous, but once you log in, I'm going to ask that you respond to this question and hit your answer. And in real time, we should be able to see these populate here. And then Mayu, yes, thank you for putting that in the chat. So slido.com, and I'll wait a moment as we watch this populate in real time, just to get a pulse of how we in this room are engaging with burnout. And then hopefully this is self-explanatory, but we'll see these grow, and the percentages correspond to how much of the population is feeling which of these responses. And so I know we're seeing them come through in real time here, but early responses, we're seeing some people in this room, a tie in this moment, okay, a winning percent at this moment of feeling under stress, maybe not feeling burnt out, but then very closely followed by, yes, I am aware that I'm definitely burning out and I can already pick out some symptoms in myself. I'm seeing some people in the phase of really struggling with burnout, so feeling that the symptoms are not like ebbing and flowing, they feel pretty persistent. And then even some feeling like burnout is extremely present and recognizing a need for help to intervene. So I'll wait just another moment to start seeing these come through, but it's good for us to just have an understanding of who's here, and then especially, most importantly, for you to have an understanding of where you feel like you fall on this and what you might need to take from this presentation. Okay. And just as a way to interpret, if you said that you obviously like enjoy your work or just occasionally under stress, or feel like you were kind of like at a 2 or less on the scale we can think of, if this was on a like 1 through 5 scale, you would not be considered as experiencing burnout right now, but those higher responses may be indicative that you are experiencing some sort of emotional exhaustion or prolonged stress at work. So with this context, let's move on to seeing what is the prevalence and impact of burnout in our broader society. So burnout is on the rise. As Mayu said, this is a very timely presentation because we are noticing that employee burnout is increasing across many fields. Even in 2018, we found that in a Gallup poll of 7,500 surveyed employees, 23% of respondents said that they were very often burned out, and 44 respondents were sometimes burned out, which is a total of, pardon my math here, but well over 60, maybe close to 70% of respondents saying, yes, there is some burnout that I'm noticing, and closer to only 30% who are like, no, I don't relate to this. And this was back in 2018. We also know that chronic stress and burnout can contribute to mental and physical health conditions. So experiences often do overlap with symptoms of depression, which we'll get to in a second about like how to maybe consider disentangling those, seeing that they are often so related. And then we also see, as a result of burnout, an increase in absenteeism and attrition in the workplace. So employees who are experiencing burnout are 63% more likely to call out sick from work, 23% more likely to visit the emergency room, 13 to 20% more likely to report feeling a lack of confidence in their work and their abilities, and 2.6 times more likely to be seeking other employment. So just thinking about the scope of burnout, it's not just that you're kind of managing it on your own. It shows up in a lot of other aspects of your life and in other spheres as well. And then yes, burnout does obviously interfere with family and social life and responsibilities. So it's not just contained to the workplace that you may be noticing the impact of your burnout. Just another note about some of the physical health consequences we see with burnout. Burnout is linked to some pretty serious health conditions, including depressive and anxiety disorders, alcohol dependence, sleep disturbances, headaches, GI infections or issues, and then even an increased risk of coronary heart disease, type 2 diabetes, infection, and musculoskeletal pain. So just kind of keeping in mind the scope and prevalence of burnout does go beyond just, I'm feeling disconnected or I'm feeling fatigued at work. It is quite a bit more than this. And then let's not forget the role of the pandemic in exacerbating burnout. So the figures you see here are taken from some preliminary reports from the CDC about the psychological impact of the pandemic. And so the pandemic has definitely increased employee distress, but it's also important to note that burnout is not a new phenomenon. So before COVID, you can see here, 40 to 60% of the population was doing well with little to no clinically significant levels of anxiety or depression, but that number has dropped so that now actually only 20 to 40% of the population is not experiencing an adverse mental health side effect. So said more plainly, and to like TLDR that a little bit, this means that 60 to 80% of the population has suffered psychologically from the pandemic, and 34% of individuals have clinical levels of symptomology. And so talking now about common burnout experiences. So I know we did that first poll, but that was very high level, just kind of an assessment of where do I feel like I'm at in this moment. This hopefully can help paint a little bit more of a picture where, as I go through these, I want you to think for yourself, which of these might you relate to? This might help kind of paint a picture of burnout for yourself, and if this is something that is showing up for you in the workplace. So some very common burnout experiences include working long hours with less or no time for family and friends, or finding that you're really disengaged when you are present. So maybe you are still following through on your commitments, but you're just not feeling attentive or focused when you are hanging out with friends and family. Feeling easily frustrated, problems in personal relationships. I jumped ahead there. So this could look like maybe you are not attending to your friends as much, or your friends are finding that you're not giving the type of feedback that they expect from you, or you're like flaking on your friends. This can take like a number of forms. This also can show up in romantic relationships, similar issues of maybe not being present, maybe being disengaged, maybe being snappy. Maybe you're finding that like stress from work is showing up in your communication. Easily frustrated, so like less compassion or patience for colleagues or customers that you might engage in. Feeling disinterested in work and just generally unenthusiastic about projects that come your way. Feeling an increased sense of negativity or pessimism about work when you think about it. Having difficulty setting boundaries between work and home. So noticing that you're carrying this emotional toll with you. So if you're interacting with clients or customers, maybe you find yourself thinking a lot about them after your workday is done. Maybe if you are someone who is working from home right now or working in a hybrid role, you find that that blurred line between work and home is really blurry. So maybe this isn't even that you're going home from the office and thinking about work, or maybe this is that the office is not separating from home. We've seen a lot of, throughout society, in some professions, moving to a more hybrid model or even a fully remote model. It's a lot harder to disengage from work. Feeling emotional or physical fatigue, and then generally being less interested or engaged in those activities that promote health or well-being, such as finding time to exercise, finding time to eat well, be outdoors, engage in relaxation, etc. And so, as mentioned, I do want to take just a moment here to kind of pick apart stress, depression, and burnout. You can think of these three as, I don't want to call them friends because that makes them sound too like jovial. They're not very fun to experience. So I feel like that doesn't quite do it justice, but they're very close and they can often be hard to distinguish from one another. And so let's give it a shot though. Stress, first of all, is really, I'd like to think of stress as just having too much on your plate, right? So stress is too much work, too much responsibilities, too much to do. Whereas maybe you can think of burnout as being kind of the opposite, where burnout is more of like a deficit. So a deficit of interest, a deficit of motivation, a deficit of care, deficit of energy. So that's kind of a way to distinguish those two a little bit. With depression, there are certain depression-related symptoms that can often be mistaken for burnout or can be symptoms of burnout. But it's important to think that burnout, and remember, it is work-related, right? So burnout really does pertain to the workplace, whereas depression can be caused by and show up in a ton of different aspects of life with the similar feelings of feeling hopeless, worthless, helpless, whereas burnout really does stem from issues at work. And while burnout can cause us to feel really negatively towards like maybe one specific situation, depression can cause us to feel withdrawn or ambivalent about a lot of different situations at the same time. And then lastly, burnout, we can think of maybe as feeling like we failed in one aspect. So maybe we feel like we're failing at work or we're not doing well at work or feeling unsupported at work, whereas depression, we can have those feelings of like low self-esteem, low self-efficacy, more broadly. So feeling like maybe we failed as a person, failed at life. So that's a little bit of a way to kind of separate them, but I will say these boundaries are very, very sticky. As we said, burnout often can look like depression, and they often do go hand in hand. So I say this to kind of help give just a little bit of a framework to parse these apart if you're not sure if you're experiencing 1, 2, or 3. But the best way to kind of get clarity on a diagnosis, as always, is to talk to a mental health professional about your unique situation. And so we have one more chance to reflect here. So thank you for all of you who participated in the last poll. We have one more actually coming our way. So we're going to head back to Slido here, but you're going to use a different join code. This time it's this 2157805. And together what we're going to do is actually just make a word cloud. So thinking of the first word that comes to mind that you feel like describes or encapsulates your current work experience. And in real time, we'll see just one more pulse on this room here. What comes up when we think about work? So first thing that you would say kind of sums up or describes work right now. And together we'll see these form a little bit of a picture where the more common responses will be larger and maybe the less common responses will be smaller. So I'll wait for these to start coming in. Okay. So already busy, overload, another busy or elusive. Feeling taken for granted as one, absolutely overwhelmed. Never ending. Okay, now we can see as more responses come in, the larger words are the words that more people in this room have identified. So busy is obviously really jumping out as a big one. Value misalignment, monotonous, boring. I see those sometimes going hand in hand, potentially endless. Feeling very drained. Undercompensated, low continuity, long hours. Absolutely. So even as I'm seeing these come in, I'm just thinking a bit about what we've said are some common experiences of burnout and some of the things that are job demands, right, that we already mentioned. So feeling like we don't have maybe a diversity of duties or feeling like our work is unstable, feeling like we have a lot that we're juggling can be things that all could contribute to burnout. So I'm seeing some of that come up here. No motivation, feeling everything is urgent, definitely. Okay, we'll take just one more moment. I think this is helpful to see just even in this room. I know we can't see each other right now, but I'm getting the sense that even though not everyone said, yes, I'm 100% at burnout in this moment from that first poll, we're seeing that the experiences right now are pretty shared across the board of experiencing work as, I guess I'd kind of sum it up as busy and never ending, but then also just a lot on the plate that you all are managing here in this room. Okay, I'm going to jump back to our slide deck, but thank you for those of you who contributed here. And so this kind of ties into this slide, that last question. So right now we've kind of gotten to the point of what is burnout, who defined it, how do we first hear about it, and what it can look like. We're now going to start moving on in just a moment to the like what to do about it. That's probably maybe why many of you are here is like, all right, what are the skills or the techniques? Those are coming, I promise. But before we get there, I wanted to include this slide where we can take a moment to just really validate what makes it really difficult to cope effectively with burnout, okay? So what you've seen here is a slide of some common vulnerabilities that may prime us to experience burnout in the first place. So if you're experiencing these things in your life, you may be more likely to be burned out. And these also could be considered some common job demands, if we think back to that prior discussion, that make it really tough to engage in the coping strategies that we know are helpful, or that really, again, exacerbate or prime us for burnout in the first place. Okay, so it's kind of a smorgasbord of things, basically like these things make burnout more likely and harder to manage. And so why I wanted to put this slide in here is because I think it's really important to validate why burnout is so hard to manage and what all the different things are that contribute to it before we get right into like problem solving mode, because I think this helps like give a little nuance to this, right? Some of the skills I'm going to go over are ones that are not necessarily maybe that novel. They're things that may feel really straightforward. And so before I sit here and say like, drink more water, and you're like, are you kidding me? Let's like take a moment to acknowledge that it's not that easy, even though drinking more water is helpful, and we'll get there in a second, but it's not that easy. And so I want to just make sure that we have space for that discussion as a way to just compassionately acknowledge why this is hard before we get straight into what to do about it. And so what I'll ask you to do, if you feel comfortable, keep in mind if you choose to respond in this chat here, that people may be able to see your name. So don't feel like you need to respond in this chat, but if you feel comfortable and want to participate, I'll ask you to type in or just think mentally how many of these obstacles you relate to, okay? So take a moment to read through to kind of help validate and give some context for yourself, how many of these obstacles you find yourself relating to. And if you want to share, great. If not, no problem. Just a moment to read through it. Thank you, Mayu. That's helpful. So if you did want to share just with us, you can choose that option. If you do feel like sharing with the room, you're welcome to, or you can take a moment and just kind of hold on that number for yourself. I see a Q&A answer coming through. I don't know if everyone else can see that, but I will read it just in case. One individual in this room said there's 3 of these that are definitely jumping out. So parenting demands being a big one, fast-paced changes at work, and disconnection were 3 that this person was able to identify as being relevant for them. Thank you for sharing that. Okay, so 7 here, right? And then an important nuance, you count caring for elderly parents as parenting. I would say the demands probably feel similar, right? So maybe it's not what you typically think of as parenting children, but having to be a caregiver absolutely could make a spot on this list, whether it's as a parent or as a child caring for a parent. We see 5 here, parenting demands really sticking out as the most taxing, absolutely. Yeah. So what I will say, take a moment, 7 coming in. So a lot of like retweeting here for parenting demands, busy schedule being a big one. I know we saw that from the word cloud. I'll just say I've run this webinar slightly differently, but for different groups. And every time I've done this, the one thing that we're unified in is that I've never, ever, ever had someone say 0 No one has ever responded and said, yeah, none of these things relate to me. So I hope, if nothing else, this is a little bit normalizing and noticing that these are really common and are obstacles that really make coping with burnout super, super hard. Thank you for those who felt comfortable sharing here. And I hope everyone was able to just think for themselves what they related to. So let's move on. There's one other thing that I would consider an obstacle. Okay, thank you. So yes, so parenting, maybe this is good feedback for me for the future, being more inclusive with caregiving. So I wanna just verbalize that for other people here in this room where maybe you aren't a parent, but you're noticing that you're feeling the same demands. Definitely caregiving should go on here as its own category and a broader category. Thank you for that feedback, that is important. And so moving on, just to really give space to one more element that I wanna make sure gets its own airtime here, is this idea of shame as being a barrier or a obstacle to dealing with burnout. And so shame is really similar to guilt, but it's different in that shame is a perceived sense of I am bad, whereas guilt is more of this sense of something that I did is bad. And I think of shame as being really, really sticky. Okay. So we know that shame prone individuals are at an increased risk for anxiety, depression, and lower self esteem. And why I include this here is that I imagine many of you may work in some sort of service profession. That can take a ton of forms, right? Or at the very least, you may have some sort of clients or customers that you help out in some way, delivering some sort of product or some sort of service or some sort of support for someone in your life, potentially in the type of work that you do. And even if you don't feel that you serve anyone directly in your outside life, you probably are a support to someone. Maybe that is caring for a parent, caring for someone in your life. Maybe you are a partner or a friend to someone. I mean, there's a lot of roles that each of you I know play. And I think it can be very common that some of us may refrain from seeking support around burnout or even acknowledging that we feel burnout in the first place because of this feeling that I shouldn't be feeling this way, or that I should know better, or I don't have it as bad as someone else potentially. We're really good as people at doing the comparison game. And so there often can be a feeling of, yeah, maybe I don't even recognize that I'm burned out or allow myself to think about that because I feel like I shouldn't be, or in this job climate, I should just be grateful for having a job and not even acknowledging that both can be true. I can be grateful for being employed and also really struggle with what's going on at work right now. Feel really overburdened, feel really taxed. And so according to researcher Brene Brown, who I love and I hope some of you may have heard of, shame can grow really exponentially if fueled by three things. Okay, and the three things that Brene Brown said can really fuel shame are secrecy, silence, and judgment. And so luckily she didn't leave us there. She does say that there is this antidote for shame, and it's again a three-part process. And it's firstly to talk to yourself like you would talk to someone that you love, to reach out to someone that you trust, and to tell your story. And so Brene feels very firmly that shame cannot survive being spoken, especially when it is met with empathy and understanding. And so why I give this its own little airtime here is just if this does feel relatable, I want you to just consider the role that shame may be playing in your ability to even acknowledge or accept help for feeling burnout. And think about whether you could see it, stopping you from taking any needed steps to prevent or address your work-related burnout. And just think about this three-step process here of if I'm able to name it, then maybe I'm able to do some work around it. And so with that, we're now going to move on to the role of resilience in buffering against burnout and bolstering an adaptive response to stress. So resilience is defined very briefly in the dictionary as the capacity to recover quickly from difficulties or toughness. You can also see a much longer definition pictured here. And so previous research really used to frame health professional resilience about really just avoiding burnout. So it's all about be less stressed. How do you reduce stress? How do you not let it impact you as much? But more recently, the wider literature on personal resilience says that it's not just about not burning out. It's more about actively choosing and finding ways to develop personal resources, okay? So it's not just don't burn out. It's what can I do to help myself develop skills and tools that can support me from the stressors I might have in my life. And so while some people may inherently just have more resilience. Luckily, resilience also can be developed and built. Okay, so resiliency building can be shown to help us lessen stress, manage emotions, and even decrease the severity of PTSD symptoms, in addition to preventing burnout. One small 2008 study and interview with healthcare professionals found that there are 4 key traits of resilient healthcare professionals, just to kind of keep these as an idea of what those people were doing, what was the magic sauce that was helping them be so resilient. And it was these 4 things. So perspective taking and finding value in your role. So being able to see your work as significant, meaningful, or contributing in some way. Achieving balance and prioritization, whether that's both in work or potentially outside of work. So finding a way to feel this balance or ability to know what is most important or most on fire at this point in time. Having supportive relationships, again, both inside and outside of work. And then lastly, effective communication. So being able to express themselves effectively when they have needs, again, whether inside or outside of the workplace. So 4 key traits we found in resilient healthcare professionals. And so we're going to spend some time now, really most of the rest of the discussion. This is that like how to prevent against burnout and how to manage burnout part of the discussion. And we're going to talk about these skills through this biopsychosocial model. Okay. And so what we see here is these 6 different categories of techniques for managing burnout that kind of cluster up into these 3 main areas. So looking at biology, psychology, and your larger social context, what the different skills are that we can choose to actively build for ourselves to cultivate a sense of resilience. And so before we get into the specifics, I'm going to try and share one skill from 4 of these 6 areas, just in the interest of time. Before we get into the very concrete, I do want to just say, I recognize the challenge here always is how. So how do you take care of yourself? How do you find time when there's like a million demands on your plate? And so we're going to go into a couple of these in more detail, but while none of this may be too revolutionary, what's really important here is to remember that with each of the skills I'm going to share, it's really about consistency, and it's really about small steps to building healthy habits over time. So for those of you who have participated throughout our Mirror Health program, I'm sure that does not sound unfamiliar, but really as we go through these skills, keeping in mind this idea of if I'm choosing to practice them with consistency to build a habit, that is when I will see the impact and the rewards of what's discussed. So the first technique that I'd like to share with you comes from this broader category, the one that was processed and release difficult feelings. And the specific technique I want to introduce to you is this idea of doing a self-check-in. And basically, we can't take care of ourselves and we can't help ourselves if we don't know what we need or how we're feeling. So if you're someone in here who already has a consistent mindfulness practice, that's one really nice way to spend 5 to 10 minutes. Maybe it's in the morning or it's in the evening. Maybe it varies depending on your day, but just spending some time becoming really aware of the present moment and what's coming up for you. That's awesome. If you don't currently practice mindfulness, what I've included here is this little diagram that I really like. I think it's a nice way to kind of help essentially like drop a pin in how you're feeling in this given moment in a framework that might be a little more concrete if mindfulness is new to you or not something that you've spent a lot of time in. And so what I've shown here is this CBT model, right? So cognitive behavioral therapy is a type of therapy, and this model is called the CBT model. And it really is a nice framework to help you just quickly assess or inventory how you might be feeling right now. Okay. And so what we see with these little arrows is this belief that our thoughts, our emotions, our behaviors, and our physical reactions are extremely interconnected. And that if one changes, the others change, and they all tend to kick off each other. And when we're in a situation, they all tend to light up in a certain way. And so what this can look like is if you notice that, let's say you're at work and you're feeling really off, but you can't put a name to the emotion you're feeling. For some of us, being able to name emotions comes really late in our consciousness. Maybe we're really good at identifying specific thoughts that come up in our mind, or specific behaviors that I have the urge to engage in. Or maybe I'm better at noticing where I feel tension in my body, or like a twinge of discomfort in my stomach, or I notice I get headaches when X situation happens to me. And then once we can become a little bit more aware of, okay, wow, this chain of events happens every time I'm in this situation, we can start becoming better at noticing, oh, that's actually what anxiety feels like for me, or that's what feeling unheard really feels like for me at the workplace, for example. And so I say this just as a way to kind of help maybe ask yourself, when things might feel off, consider looking at each of these areas and asking, what is one thought I'm feeling? Can I notice one behavior, one urge, one physical sensation, or maybe I can name an emotion just to know what's showing up. Because then once we can name the emotion or we can name the experience, then we can figure out what to do with it. And so I've named just a couple ideas of skills here of how you could address an emotion once you've identified what the emotion is. And so the first skill that I'd like to quickly just run through here is the skill of building mastery. And really short and sweet, what building mastery is making time and intentionally choosing to do something that you are good at to build confidence and positive emotions. And this doesn't have to be huge, okay? So for me, something that I love to do to build mastery every day is I really love playing Wordle. I don't know if any of you also love playing Wordle or enjoy words or crosswords, but between Wordle and the Times Daily Mini, that is something that I make a point to do every day during my lunch hour. It's quick, takes like 5 minutes, depending on how quick I am or how readily I get it. But I feel really accomplished when I finish, right? I'm pretty good at Wordle. And so that's something small, but it helps me feel like, okay, I still got that. Like if I can do that, I can probably go deliver hopefully a pretty good presentation later today, or I hopefully can do a good job at this thing at work later in my day. And it doesn't always feel that conscious, but I notice that there is an increase in my mood and in my kind of like sense of how I carry myself, even from something as like silly and small as Wordle. So you may have a different thing. You may not all be Wordle fans like I am, but you may have something that you know is quick, is easy, but that you feel like you're pretty decent at. And that can be a nice thing to choose to intentionally practice, whether it's at work or even in your life outside of work, to help build that sense of confidence and carry with you throughout your days. Another thing I really love is self-soothing. And so self-soothing is choosing to engage in a pleasurable activity that is truly designed for relaxation and calm. So if you think about this at work, this could look like having a cup of hot tea that maybe you have like a little tea warmer at your desk that you can sip on throughout the day, or having a sweet treat that you keep near your desk. I know when I worked more consistently in an office, for me, it was Jolly Ranchers, much to probably my dentist's displeasure. But it was something small that I found that I could enjoy throughout the workday, and I liked it. It felt soothing to me. This could also look like maybe having a warm blanket that you have draped on the back of your chair. Like, none of these things probably sound that huge, but if you can think of them with intention, if you find that you're at work and you have an extremely stressful interaction, or you feel like you just got a ton of stuff dumped on your plate and you notice this feeling is creeping up of feeling maybe overwhelmed, of like dysregulated, turn to some self-soothing in a quick moment with whatever's your item that you've chosen to have by you, and that can help even if it's brief. If you're a diffuser person, that also can be something nice. Again, small things, small techniques, but could have a big impact if used with intention and for a specific purpose. Creative expression, I love. This is your classic journaling, drawing, playing music, or any other method of expressing emotions. This doesn't mean bring your saxophone to work, but this could be something outside of work if you have a hobby, making time to engage in that. Or even if there's something small that could be done at work that you enjoy. Maybe you're a doodler, maybe you spend a little bit of time as you're taking notes, like doing something on the side that you find is enjoyable. It's small, but it can go a long way. And then very lastly, cultivating positive emotions. So this really means choosing to bring about a different emotion than the one that you're feeling by engaging in a specific action designed to make you feel the new emotion. So this is where you can think of, like, if you have 5 minutes to go to the bathroom and flip through your phone and look at photos of an old vacation that you really can't stop thinking about and that you felt really, really at ease in, maybe that's like looking through that and allowing yourself to feel the feelings of kind of being transported back to that space. Maybe this is your puppy video time, right? You watch a couple TikToks of cute dogs, and then you maybe feel a little bit better. You notice that all of a sudden you're smiling, even just smallly, which maybe 10 minutes ago you couldn't have even imagined. Maybe this is a quick podcast or a favorite stand-up clip, like small, brief things that are intentional to bring about a different emotion. This skill is not about changing your experience of burnout necessarily as a whole, but this is about how to get through a tough pinch in a quick way with a couple techniques you can hopefully keep in your back pocket. The next one here comes from that broader category of take care of your body. And here I've created this quick and easy little diagram that I invite you to take with you. And this is SEEDS. This is our acronym for Foundational Self-Care. I've adapted this from Marsha Lenehan, who is a DBT expert, dialectical behavioral therapy. She has this cool skill called Please Master, but this one's just a little shorter and sweeter, but it's the same premise. And what I've done here is had the different letters of this word SEEDS correspond to different important parts of foundational wellness. Okay, so we've got sleep, eating, exercise, following doctor's orders, which can take a couple different forms here. And then lastly, this structure, sense of structure for yourself, that can be really helpful just to keep in mind. And what I say for this, I want to just be clear, is that having 100% of like crushing it in all of these categories is not possible. There is not enough hours in the day to feel like you are sleeping the exact right amount, eating perfectly, exercising to a T, being the model like doctors patient, and then having an exceptional sense of structure. It's just not possible. Okay, so I want to say that first of all. Why I introduce this rather than setting this unattainable goal that you're just going to feel bad about is to use this as a framework to ask yourself, when you're feeling crummy, which area of SEEDS do you feel like has been neglected the most lately? Okay, so oftentimes I know for myself, if I'm feeling just like off, it's almost always sleep for me. I can fall victim to being on my phone too late at night or getting sucked into a project sometimes. And next thing you know, it's been a couple nights and I am just not hitting those 8 hours. And I feel it. I notice that I'm more irritable. I notice that things feel like a bigger deal when I haven't slept well a couple days in a row. That probably wouldn't have bothered me if I got rest. So that's my cue. And then I notice, okay, I really know that the value I get out of playing on my phone for those 20 minutes a night is not worth the like crankiness that I'm going to be feeling on Friday. So I'm going to set a small goal tonight to get to bed 20 minutes earlier. So that's how I want you to think about this as well. Is there one area that I can identify that I've been neglecting, especially lately? And can I set one extremely small concrete action intended to prioritize this area today and then commit to it? And I guarantee you will see progress. I guarantee you will feel better having chosen and committed to the improvement that you've identified. So I babbled a little bit, but I'm going to leave this up for just 1 second so you can take a look at just a couple of the ideas here of different ways you can achieve progress or improvement in these areas. And then we'll move on to the next section. Okay. Cultivating positive outlook was another one of those resilience building strategies. And here I've got a couple ideas of ways that, in short, are really about staying solution focused in the workplace. Work can be extremely tough, but it is very important to not turn what's already a painful time into a time of extended suffering. Okay. So, one way to do that is to be realistic, but also to have a temporal perspective. So, try and catch if you notice that you're engaging in hyperbole or all or nothing thinking. So, thoughts such as, this job is never going to get better. I've always felt like no one listens to me here. No one ever sees how hard I'm working. I never get praise. I'm hoping those buzzwords are already kind of putting up red flags for you, because odds are those all or nothing words are not helping paint a very accurate picture. We're looking through one lens and we're kind of like ramping ourselves up by maybe neglecting or not paying attention to the times, even if brief, that we have felt appreciated or that we have seen success in the workplace. So try and kind of catch that all or nothing thinking, and then also work to put a timestamp on how you're feeling right now, okay? That could look like work is challenging right now. This has been a really busy 3 weeks, but there's been times that it's been easier. And I know that in next quarter or like next month, I'm going to get additional help on hand and it's going to be better. Or I know that this client will no longer be on our books, whatever sort of work you do, but how can I help just kind of stress to myself, even in my languaging, that this is a right now issue. It may not be a forever issue, can make a difference. It's also helpful to try and see opportunities through the eyes of what's possible, right? So maybe this is difficult, and is there something I can do to help make it even a little bit better? Is there something I can ask for? Is there something I can advocate for? How can I start trying to think for solutions rather than sitting in like, this is not going to ever get better? Another one I really like is essentially just giving others the benefit of the doubt. So when work is tough, it's really easy to feel like everything your colleagues or your clients or your customers is doing is like designed to just like drive you nuts. But if we can choose to intentionally give others the benefit of the doubt, the only person who really benefits in that is us. The example I always like to give is if you've ever been driving and someone has cut you off in traffic. There's two ways we can handle that. One is to say, wow, I'm guessing that was someone who had something really important to do today. Like maybe that was an elderly driver who didn't see me and it was an honest mistake. Or maybe it was someone who fell victim to the classic trope of, they have to get to the hospital immediately, right? And I'm just going to choose that there was a good reason why they cut me off in traffic. Other option is to say that person is such a jerk. I can't believe they do that. They clearly think their time is more important than mine. And now I'm feeling frustrated and I'm mad because someone has done this that now has like started bothering me. In reality, we have no idea what's going on in this car, but if I choose to believe the first and choose to assume positive intention, I'm not going to feel as crappy as I would if I chose to believe that it was an intentional slight. And this is the same thing at work. If we can just choose to believe that everyone is doing the best they can with the resources they have, whether or not that's true, we'll probably feel a little bit better and be able to turn our focus back on ourselves and the things that we need to do to help get through our day and our situation. And then very lastly, I really like this idea of practicing gratitude. I know for those of you who completed the Mirror program, you know all about gratitude, but this looks like finding ways to acknowledge small wins at work, right? And this isn't all roses and butterflies, especially when work is really difficult, but this could look like challenging yourself to figure out 1 to 3 things every day that weren't awful or that you could say went quote unquote well enough, right? And these could be things like, the sun was streaming through my window at my desk really beautifully today. Or I did get one nice comment from a customer. Or, they brought in pizza at lunch and it was pretty good. Like these don't have to be monumental things, but I like finding a way to actually record these. I've suggested here this app called Happy Feed that I really like, where you can kind of keep a timeline for yourself of positive things. I think it prompts you to put in like 3 things today that you're grateful for, but you can do pictures, you can do a note, it could just be, again, things that I want to remember from today. And you can look back over time and see a timeline of things that went well or that were positive. That could be nice to look back at, especially when you're in a low moment and it feels like nothing at work has ever gone well. The timeline is really, I think, invaluable. It's kind of like someone who's maybe working on their fitness and they always say, like, take a progress pic, because like when you're in it, you never feel like you're progressing. Then, oops, sorry, that was my doorbell. I don't know if you heard that. Apologies, I just jumped. But that's a nice way to be able to say, like, okay, I have noticed progress over time and I can look back and acknowledge that even if it doesn't feel like things are going right in this moment, I know they have in the past. And then last but not least, creating connection and belonging here, really thinking about building community and seeking support. We are social beings hardwired for positive emotional connection and sense of belonging. And research has showed that having just one person to connect with causes us to be 10 times less likely to be depressed. So as we talk about workplace burnout, it's important to just think of ways we can start building connection both at home and in the workplace. So not just at work, but at home as well. At home, this looks like finding time to shut off the computer and making time to connect with family, friends, roommates. Be careful not to work right up till bedtime, especially for someone who works from home. That can really sneak up on you, but finding that boundary, finding ways to be present with anyone who might live in your home, or finding time to go make time for friends, even in the evenings, even if work's really busy. Consider creating some sort of evening routine if you share a home with someone, or maybe you share a note about your day or trade a story. Connection also doesn't have to only come in the form of people, right? This can look like connection with pets, connection with nature, music, art, interests, or joining larger community organizations such as special interest groups, volunteering, things like that can all be ways of finding connection outside of work. At work, this could look like finding a colleague who could be your accountability buddy, for example. So we talked a bit about some of those seeds goals. Maybe you have someone who together you both commit to taking a 10-minute walk at lunch, or maybe you buy one of those cool water bottles that has like the ounces on it and you compete with one another to see who can drink a little bit more water and stay hydrated. It could be someone who knows that you're going through a hard time at work and together you work on trading strategies for helping clear your calendar a little bit better, or find a different structure of your meetings that feels good and you trial it together. I think having someone who kind of can understand what you're feeling and encourage you, if there's even one person, can really make a big difference in work. I also think if you're on a team, thinking about ways to help build up a team atmosphere. Maybe your team feels really siloed and it might feel awkward, but you're the person who says, you know what? Every morning, I want us to start by talking about what we watched on TV last night for 10 minutes or 5 minutes. Maybe you'll have some sort of ritual, or every Friday you do something at lunch together. Like, odds are, if you're feeling disconnected, probably other people are too, but no one might want to make the first move to establish that sense of connection. So think about if there's possibilities for that in your team, in your department, might help go a long way. And then lastly, remember that your manager and HR are there for you as well. Research has found that forming high quality relationships with supervisors can really buffer against the impact of burnout. And then HR is there to help equip you with needed supports or time off should you notice that your burnout symptoms are requiring additional attention or possibly workload shuffles if possible. And then I added just like 3 extra bonus things here. This one I think is so important, is that if you're taking time off work, take time off work. I think there's sometimes, depending on your workplace, a feeling of I can take time off work, but I still feel expected to be online, or I feel like neglectful if I'm not online. So I think if you notice that you fall into this camp where you're like technically taking time off, but still not really getting that space, really just ask yourself, is this a must do item or a want to do item? And will completing this task really make my life easier when I come back from vacation? Or will it just make me feel resentful that my time off wasn't really rejuvenating? And then will I come back feeling maybe even more burnt out or unappreciated than I was when I left, right? So helping weigh for yourself, if this is really gonna make me feel better, and I know it's a positive benefit, maybe I'll choose to complete it. But odds are maybe it actually won't. And then I'm just gonna feel like I didn't make the most of the time that I maybe really, really needed. So something to think about here with PTO. Also, be thoughtful of burnout contagion. I think it's great to have accountability buddies at work. It's great to have a team. It's really nice to feel validated, but it can quickly, sometimes conversations around like what's going wrong at work can turn into workplace spiraling. So it's hard to like step out of that if that's kind of like the workplace culture, but think about how you feel before and after, right? Do you find that those conversations are making you feel better? If not, be thoughtful around what's my intention of bringing an issue up to this person. Is it just to kind of fuel the fire and then we all just leave feeling really frustrated with work? Or am I trying to find a solution? And if so, can I go into conversations with that lens? And then I might actually see progress in my situation and maybe be a good model for others to kind of find ways to find solutions or improvements in their situation as well. So there's something to be careful of because I think it can be a fine line. And then lastly, asking for what you need. Okay, so rather than just powering through or feeling like this is just work, I just have to like put my head down and do it, voice any concerns you have around the job or the organization that might be contributing to your experience of burnout. This could look like communicating some of the symptoms you've noticed or areas of improvement, needs for tasks that need to get off your plate to a supervisor or HR to really think about, are there accommodations? I think sometimes we can tell ourselves it's just not possible. I know everyone on this team, everyone's overloaded. But when we take it to someone whose job it is to help the team function as effectively as possible and delegate, you can kind of like put that on them to help you figure out how to make that happen rather than feeling like you have to shoulder that yourself. And so I want to be mindful, we're coming up to time here, but I included just a brief Dear Man refresh. So take a moment to read through this. I think probably Dear Man is familiar to all of you, especially who were here at Ashley's presentation recently for our last webinar series. And for those of you who went through the Miro program, this probably looks familiar. But the gist here, if this is new to you, is really just how can I use my assertive communication to ask for what I need? This is maybe an example of something that you could consider bringing to a supervisor, to HR. And it's a way to kind of find a solution. So there's a little example here of maybe what you're struggling with is feeling like you're always asked to work overtime and it's just expected of you and it's dumped on you last minute. Maybe there's a way you can set a boundary where maybe you don't mind working overtime because you get a little extra money, but it's the fact that it shows up unexpected that you're struggling with. This could be an example of, I'm still willing to do it, but I'm going to need, X many hours. And then I'll probably would be more willing to do it. And I think our working relationship would be better, but I'm going to ask you, give me this, for example. So keep in mind, dear, once you're able to identify what is not working at work and what you might need more of, this is a really useful tool to bring to the right person to ask for support and hopefully getting circumstances changed for you if needed. So I always like to end with goal setting. So we've gone over a lot of things here. I feel like I've thrown a lot of different little techniques at you, but hopefully this is a nice way to see in one slide the different skills that we've introduced, although there's many collectively, these are all things that you could choose to work on and things that you might be able to bring to the workplace that hopefully could help contribute and improve your experience a little bit as it pertains to burnout. I'll ask you, what's nice about learning skills or what's important about learning skills is not just to hear them and be like, oh, it sounds good, I'll try it someday, but to say, okay, this sounds relevant. I see this could be helpful. Here's exactly what I'm going to try and when. So getting really specific. So I'll ask you just to think for yourself before we conclude, which of all the things I threw at you sounded like it could be the most useful? And then really think about a situation in which you would choose to use that skill. So, I noticed that every day around 2 p.m. we have a meeting that I always leave feeling extremely overburdened by because there's like 8 different departments there and we all come away with to-do lists and it's like at the worst time of day and whatever. That's the time of day that is the hardest for me. So I am going to choose to engage in self-soothing before and after, and I think that would help. And then try it for a week and see if you notice any small improvements. That might be like one example of a way to kind of pick a skill and pick a situation. But I would encourage you to really take anything that sounded important or useful from this webinar and translate it into action by choosing it and choosing that situation and seeing if you implement it, what you might notice for yourself. Very lastly, I included here just a couple resources that might be interesting. One is a podcast. So it featured Brené Brown, who I already mentioned, I think is awesome. She interviews 2 doctors or has like a little dialogue with them about burnout and this idea of how to complete the stress cycle. It's really interesting. It's short and sweet. There's a podcast called Fried about burnout, which could be interesting if you're wanting to learn more about burnout management. And then a book. So Beyond Collaboration Overload, How to Work Smarter, Get Ahead, and Restore Your Well-Being. Here's just a couple of things that might be interesting to look at if this conversation has piqued your interest and you want to know more about burnout or burnout management. And with that, we are a burnout book. Oh, interesting. I have not read that. So for those of you who are reading the chat, the Nagoski sisters, who are the ones who I mentioned did that interview with Brené Brown, also wrote a book on burnout that is coming recommended. So if you are more of a reader than a video person, or maybe you start with a video and it's piqued your interest, consider looking into that book. We got a recommendation there that it might be worth checking out. I got a question. Could I get a screenshot of the demands exceeds resources slide? Yes, I'm sure, Mayu, you can give me a thumbs up or a thumbs down, but I know we have recorded this for sure, and any slides I would think we could get thumbs up. That's my pen. Thumbs up, any slides we could definitely send via email to you so that you are able to review them. So I'll make a note here of that one in particular. If there's any other slides in particular that you want, feel free to let us know. Book titles in the chat, or the book title. Maybe this is for, I can definitely put the one that I mentioned, or maybe Maya, you'd be able to do that. And then if Kelly could put in the title, if you remember, of the Burnout Book, that would be awesome as well. Okay, so
I will also be sharing those resources in the follow-up mail alongside with the recording. So you will get those later on today via email. If you can wait that long, I'll make sure to include all those resources in there as well.
Awesome. Now we have 1 minute. Let's see, last Q. Oh, we got a thank you in the Q&A. Awesome. I know we're at time, but if anyone has any additional questions, whether it's about the content, hopefully that will all be coming to you, so that will all be in your pocket, but anything else about burnout management, next steps if you're feeling burnt out, don't hesitate to reach out to us. Always happy to answer after this conversation any questions you might have. But with that, I'll thank you all for being here and for being so participatory, and I hope this was helpful. Yeah, I wish you all the best.